Hello everyone, welcome to Raaonline. Today we are going to learn about vitamin D deficiency and its management in adults. I'm Dr. Aditi. I'm a consultant in internal medicine working at Mehta Hospitals, Chennai. And let us see what today's topic is all about. Let us look at the epidemiology first to understand how prevalent this is. So, as we all know and as we all would have frequently encountered in our outpatient clinics and amongst our inpatients, vitamin D deficiency is extremely common in the Indian scenario today. About 50 to 90% of our population is vitamin D deficient, so that's a huge number. The prevalence is about 59%, and according to a report released by the International Osteoporosis Foundation in 2009, it was shown that the prevalence of vitamin D deficiency is grossly underestimated. Almost all of the neonates, 96% of neonates have vitamin D deficiency. Vitamin D deficiency is seen in about 91% of schoolgirls, 78% of healthy hospital workers, and 84% of pregnant women. So, vitamin D deficiency in India is extremely prevalent, and this is why we need to know how to recognize, how to identify vitamin D deficiency and how to treat it appropriately. This again becomes extremely handy, especially in the context of managing osteoporosis. So let us look a little bit at the vitamin D cycle. So now we all know that sun is a very important source of vitamin D. So what happens is the sun rays, the UV rays from the sun actually act on a compound called 7-dehydrocholesterol, which is present in the skin. And these ultraviolet rays convert the 7-dehydrocholesterol into vitamin D3, which is cholecalciferol, which is then taken up by the liver and subjected to the action of 25-hydroxylase. And then it's converted into 25-hydroxycholecalciferol. This subsequently goes to the kidney, where there is another hydroxylase, which is 1-alpha hydroxylase. Now this acts on 25-hydroxycholecalciferol and converts it into the active metabolite of vitamin D, or the calcitriol, which is 1-alpha 25-dihydroxycholecalciferol. This compound here, this is extremely important because this is what is going to act on the vitamin D receptor and exert its several functions ranging from antiproliferative functions to apoptotic function, differentiation function, anti-inflammatory and immune regulatory functions. So two organs which you need to keep in mind as far as the vitamin D metabolism is concerned. One is the liver, where there is 25-hydroxylase. So this is the first step, and then the second step is at the kidneys, which has the 1-alpha hydroxylase. So this is the second step which happens in the kidneys. Now there is another hydroxylase which is the 24-hydroxylase. Now 24-hydroxylase acts on this active metabolite and converts it into 1-alpha 24-25 trihydroxycholecalciferol. Sometimes it also converts it into 24-25 dihydroxycholecalciferol. So what happens is this 25-hydroxycholecalciferol, what has escaped from this 1-alpha hydroxylase, when it meets the 24-hydroxylase, it gets converted into 24-25 dihydroxycholecalciferol. Now both of these metabolites here, which have been produced post the action of 24-hydroxylase, they're all going to be inactive metabolites. So 24-hydroxylase actually plays an important role in inactivation of vitamin D. So liver and kidney, the 25-hydroxylase and 1-alpha hydroxylase is actually what plays an important role in the activation of vitamin D. So 25-hydroxylase is present in the liver and 1-alpha hydroxylase is present in the kidneys. So this is what needs to be kept in mind as far as the vitamin D metabolism is concerned. Now, what are the sources of vitamin D? Now, we all know that sunlight is an extremely important source of vitamin D, and the vitamin D that is produced post the effect of the UV rays of the sun on the skin, on the 7-dehydrocholesterol, that actually lasts twice as long as the other dietary sources of vitamin D. Now, Although sunlight is a very important source of vitamin D, there are several factors in the host which could affect the extent to which vitamin D gets produced from the sunlight. So now these factors include skin pigmentation, age, sunscreen use, several other cultural factors which involves wearing a lot of dresses, a lot of garments over the body to cover each and every part of the skin. So all of this can actually affect the amount of vitamin D that is going to be produced from the sunlight. And what is the best time, the best sun rays for vitamin D production? When is that going to be seen? That's going to be seen in the noon time. So contrary to popular belief, the sun rays during the noon, that's very effective in producing vitamin D from the skin. Now let us look at the other dietary sources. As far as the non-vegetarian diet is concerned, fish, egg yolk and meat are very rich in vitamin D. Now as far as vegetarian diets are concerned, soy products, milk, cheese, cereals, mushrooms, orange juice, oatmeal, butter, white mushrooms, all of these have a lot of vitamin D. So important ones to remember would be milk, butter, cereals, cheese. So basically a lot of milk products and soy products and oatmeal. So let us address a few burning questions with respect to vitamin D deficiency. Now vitamin D deficiency is something that we all encounter, is something that we are all aware of, something that we are all familiar of. But unfortunately, when it comes to addressing certain important questions like who's at risk for developing vitamin D deficiency, who are the population who need to be screened for vitamin D, or how do we define vitamin D deficiency, what test do we use, how much is enough, how do we treat vitamin D deficiency, and when do we stop treating these patients for vitamin D deficiency? When it comes to addressing these important questions with respect to vitamin D deficiency, most often we end up in a very gray area and not many of us have good clarity on answering these questions. So, and this is exactly what we are going to see during this session. So, let us address the first question. Who are at risk for developing vitamin D deficiency? So, who is the target population who need to be tested for vitamin D deficiency?